checking your hips. So please lay back down. Okay, very good. So first I'm gonna feel for your right. Okay, so there's no pain on the right side. There's also no pain on the left with no crepitus or tenderness to both hips. So I'm gonna just check your range of motion here. Very good range of motion, passive range of motion, and there's also good passive range of motion on your left side as well. Okay, so what I'm gonna have you do, starting with your left side, please lift up your leg, move it to the left, move it to the right, bring your knees to the chest. Very good. Do the same for your right, left first, right, and then bring your knees to the chest. So that's good active range of motion. Now with my hands on this here, try to push against my hand, up, push up, lift up, very good. Okay, now don't let me pull you up, try to push down. Good, so there's good muscle tone on the right side. Doing the same thing here, don't let me lift up, don't let me push down. Very good, so there's good muscle tone on your left side. So let's measure 5 out of 5. Okay, so I'm gonna check your knees. Okay, so there's patellar is intact on both knees. No dislocation, no swelling, no bursitis on both knees as well. So I'm gonna just have you sit back up really quickly so we can test your knees. Okay, so there's, you can relax, very good. So there's good passive range of motion on both knees. Okay, so I'm gonna just have you extend both knees and bend both knees. So there's good active range of motion there as well. Okay, so with your knees, I'm gonna push against it. Please try to extend it. Okay, very good. Now I'm gonna try to pull up. Please try to flex. Very good. Okay, so there's good muscle tone there, and it's measured 5 out of 5 for both knees. Next, I'm gonna check your ankles. So I'm gonna pull it out here. Hold on. Okay, so ankles look good so far. There is no bursitis or any swelling on the ankles. Okay, so there's good passive range of motion on bilateral ankles. Okay, so first I'm gonna have you flex your ankles, extend them, turn them inwards, and then turn them outwards. Okay, very good. So there's good active range of motion there. Okay, so next I'm gonna test your ankle strength. Okay, don't let me push down and don't let me push up. Very good. So this muscle tone is good, and there's measure 5 out of 5 for both feet. Okay, so
all right, so now I'm gonna feel your femoral pulses. I'm just gonna go under your shorts really quick. Okay. Clear's good. All right. I'm gonna feel muscle symmetry on your legs. Look at your legs. Okay. All right. Feel. All right. Let me push my hands. Thank you. Look at your toe. Right here at your femoral pulses and see if I can feel them, okay? Raise your shorts. I know that's kind of uncomfortable. I can't feel them with my fingers. We can always use a Doppler to feel those and make sure. But I'm going to assess the bottom half of your body. And if I can feel them there, then we know that they're there, okay? We're going to feel the popliteal pulses. Okay. Now I'm going to feel your posterior tibialis pulse. Very good. And your dorsalis pedis pulse. Okay. Your lower extremities are warm. Skin's intact. There's no redness, swelling. There's no edema in the calves. Skin turgor is prompt. capillary refill was within 3 seconds. Okay, I want you to pull against my hands. Okay, now push. Okay, and can you pick your feet up? Very good.
Have you had any issues walking or?
No.
No, nothing in your joints that hurts?
Mm-mm.
Your feet are chilly. Are always this cold?
Yeah.
Okay. Your hands seemed warm, so that was good.
They're cold now.
They're cold?
Yeah.
Okay. I'm going to check a couple things in your feet. I'm going to check your capillary refills, which look good. They look under 2 seconds. Your nails down here look very tidy. They look clean. They're rounded. Okay. I'm going to check for a couple pulses now.
Okay.
I would normally do the femoral pulse, but I don't have to in this instance. I also could take the popliteal one, but I'm not going to in this assessment either.
Okay.
I'm going to take the tibial pulses and the top of the feet. Okay, those are symmetric. Those are also symmetric too. So now I'm just going to do a quick range of motion for both legs.
Mm-hmm.
So if this hurts at all either, let me know.
Okay.
So I'm going to have you lift your legs straight up to the air and then back down. And then if you could put resistance on my arm, okay? And then don't let me push it down. Perfect. If you could go that way, all the way. How far can you go this way? Wow. So I'm going to have you go this way and don't let me push you any further that way. Okay, the same thing, don't let me push. Okay, this way, against my arm. Okay, and if you could do knee to chest, beautiful. And then if you could do knee to heel, and then as far as you can this way. Also, if you could do a rotation this way. Awesome. I'm gonna move to the next leg. Okay. So if you could do the same thing all the way up. Okay, now if you could pull resistance against my hand, and then don't let me push it down. Okay, all the way out. Can you go to that side? Okay, can you put resistance against my hand? And the same with this one. Okay, so now I'm gonna have you go knee to chest, and then heel to knee. And if you could go out, and then in. Awesome, so I did your reflexes on your knees already, so that should be good. So you can go ahead and sit on up.
I'm going to be touching your hips. Okay, can you lift, or I'm sorry, can you turn on your right side for me? And on the other side. Okay, turn on your side for me. Okay, thank you. Now we're going to do some hip exercises. Let me know if you feel any pain. And feel me pull and push. Can you point your toes to your nose and down to the floor? Okay, you can sit now.
The chair and put your legs out for me, because the next portion is the leg portion of the assessment. So I can see that her legs are even bilaterally and they are beige in tone with a couple primary lesions in the form of freckles. The next thing I want to do is palpate her legs for any pitting or edema. Bend your leg for you. Bend your leg. Alright, and then I can feel that there is no pitting or edema, there is no joint pain, and the temperature is normal. The next thing I am going to ask her, do you have any numbness or tingling within your feet today or legs? No. Okay, so the next thing I want to do is check the flexion of her feet. So Morgan, I'm going to have you pull your feet towards you. Alright, and now can you push your feet towards me? So we can feel that the reflexes were appropriate and that they were even on both sides of the body. So the next thing I want to do is look for any skin breakdown at the bottom of her feet, such as under her heels or between her toes, which there is no skin breakdown. So the next thing I am going to want to do is take the pulses on her feet. So I'm going to start with duralis pedis pulse, which is on the top of her foot. And I can feel that is strong and elastic. I would grade it about a 2. And then I'm going to move to her posterior tibial pulse. And then I can feel that it is also strong and elastic, and I would also grade it a 2. And now the
Legs again. So if you could uncross your legs for me, please. Sorry. All right. All right, and I'm noting no edema or redness. I also am noting that there is firmness in muscle. However, there's no hardness or bulging, which is good. The skin on your legs is intact. It is uniform in color. It is consistent with the rest of your body. I'm noting no lesions, and I am going to check your posterior tibialis pulses and then your pedal pulses as well. Alright, and pulses are graded at a 2, and they're equal bilaterally, and they're regular in rate and rhythm. I'm going to check your pedal pulse now on both legs, or both hip feet. Alright, and pedal pulses are graded at a 2 as well, and they're regular in rate and rhythm, and they're equal bilaterally. I'm now going to check for your capillary refill in your toes. I'm doing one at a time. All right, and capillary refill is less than 3 seconds. I'm now going to check, I'm just gonna have you push and then like flex against my hands. So if you could push against me. All right, and now flex. All right, and muscle strength is graded at a 5 and equal bilaterally.
So the musculoskeletal system of the lower half, so there is no varicose veins or any vascular or abnormal vascular patterns. The legs are tan with a pinkish undertone. They are symmetric on each side. Legs are symmetric on each side. There's no lesions or edema present. No lesions or edema present. No masses or abnormalities. And so the temperature is warm and dry. And so I'm going to go ahead and palpate for your lower half. So I'm going to go ahead and palpate your hip. Tell me if you feel any tenderness. Do the side and the top. Okay, now I'm going to palpate your leg, your knee. Any tenderness? Nope. Okay, now I'm going to palpate your ankle. Any tenderness? Nope. Okay, so now I'm going to go ahead and take your pulse. So I'm going to check your dorsal, your posterior tibial pulse. It's about a +1 force and it's present. And now I'm going to feel for your dorsal pedis pulse. And it is present with about a +1 force. So now I'm going to look at the toes. So the toes have a hard palate of keratin. There's no clubbing present, and there's no, I would test the capillary refill, but there's no polish on it. I would take it off at a hospital. And so it should be less than 2 seconds. And then I'm going to go ahead and assess your muscle strength. So I'm going to have you bend your leg, and I'm going to try to pull it out. Keep your leg bent, and don't let me pull it. Okay, good. So now I'm going to go ahead and assess this. So I'm going to put my hand here. I'm going to have you press your foot down like it's a gas pedal. Good. I'm going to do the same thing with this and have you point your foot up to the ceiling. Very good. All right, so now
your legs. And first thing I'm going to do is just look at your skin. Looks like you have a scar here. Have you had any issues with that?
No.
Okay. Besides that, skin is cool to the touch. Skin tone is even, and muscle mass is even as well. For now, I'll let you leave your socks on, but I'm gonna need to take those off later.
Okay.
Okay. I'm already checked her femoral pulses, so I'm gonna check the popliteal on both sides. Okay, and then the posterior tibialis on both sides. Okay, and then dorsalis pedis on top of the foot. Okay, those are all good. The next thing I'm gonna do is I'm gonna touch you either right knee, left shin, right shin. I'm gonna have you take your socks off for this. The top of your feet and the bottom of your feet, and I'm gonna ask you where I'm touching, and then if it's sharp or dull. So I'll give you like a reference first. So this is dull, and then this is sharp. Can you tell the difference?
Not really.
So can you tell the difference between that and that?
No.
Oh no.
My knees get numb in some areas.
How about up here? That?
Yes, that.
That? Okay,
yeah.
So I'll go more towards the top of your knees, and then I'll make sure that you can feel the difference here.
Okay.
Can you feel the difference?
Yes.
Okay, and then feet?
Yes.
Okay, perfect. So I'll go a little more on top of your knee. Okay, so just close your eyes and then tell me what you feel.
Sharp in the right knee area. Dull in the left area. Dull on my left foot.
Top or bottom?
What do you mean by that?
Like, this is top of your foot, this is bottom of your
top.
foot. Okay, and then
Sharp on my right shin. Sharp on my left. Dull on my right top of the foot. Dull on my right bottom of the foot. Dull on the left bottom of my foot.
okay, she got an 8 out of 8, which is good. And then it's important to remember to always use dull on the bottoms of your feet.
Okay, and this is the microfilament, and you would be able to feel the pinch like this. Okay. So make sure that it's bent so that you can feel it. Okay, so let me know where you feel it.
On my big toe.
Okay, right or left?
Side, right side.
Okay.
You can feel it. You can feel it. You can feel it. You can feel it.
Okay, good job. Okay, we're doing the same thing on here. Okay, let me know where it is.
On my big toe on the left foot.
Okay, can you feel it?
I can feel it. I can feel it. I can feel it. I can feel it.
Okay, so the sensation on the bilateral foot is normal for the microfilament. The next thing I'm going to do is the vibration of the big toe to check for your sensation, bone sensation. So I'm just going to vibrate, put it right here. Can you feel the vibration?
Mm-hmm.
Let me know when it stops.
It stopped.
Okay. And the vibration on the other leg.
Mm-hmm. I can feel it on my left foot.
Okay. So she's able to feel it, so that's normal. So the big toe vibration. Now next I'm going to do is the proprioception. Okay. So I'm just going to move your finger, the toe. I'm sorry. I'm going to move the toe, big toe, and let me know if I'm going up or down.
Okay. Down. Up. Up. Down.
Perfect. So that's normal. Okay. When I'm here, I'm also going to do the leg raise test.
Mm-hmm.
Okay. If you can raise this leg straight up as much as you can and let it down. Any pain in your back or anywhere?
No.
Okay, so that's leg raise test is normal. If she feels pain in the same leg, ipsilateral pain, that would be positive for sciatica. If she felt pain on the contralateral side, which is the opposite side, that would be positive for the herniation disc. Okay. Can you move your hip adduction and abduction, like going in and going out? Okay, that's good. And the other, okay, up and down would be. Oh wow, okay. So range of motion for the hip is normal, and push my leg against, okay? Again, this one, and here. Down, down, okay. So range of motion is normal, and strength is 5 out of 5, okay? Bend your knees, okay? All the way, and go out. Okay, so that's the range of motion of the knee, and that's normal.
Okay. I would test for capillary refill, but there's nail polish on, so in a clinical setting, I would ask the patient to take the nail polish off. The nail beds are at a 160-degree angle with no clubbing present, so now I'm going to test the posterior tibial pulse. Pulse is equal bilaterally, and the dorsalis pedis pulse. Pulse is equal, so now I'm going to feel for any masses or edema in the legs, none present, and for skin turgor. And there's no tenting. So I'm now going to move on and test the sensation in your feet. This is going to be soft. This is going to be dull. And that's going to be sharp. Alright, so I'm going to ask you to close your eyes. Soft. Soft. Dull. Dull. Sharp. Sharp. Alright, so patient has feeling in both her feet. Now I'm going to ask you to lift one leg up to your chest. Alright, and the other one. I put one leg in the air. And the other. And I'm going to ask you to put one leg out. And the other. Alright, so I'm going to go ahead and have you bend this knee. I'm going to go ahead and find your popliteal pulse. I'm having trouble finding it, but that's completely normal. I'm going to try this one, and if I can't, I'm going to grab the Doppler, okay? Good. I'm just going to pull these socks down. Good, both sides are strong and equal. I'm going to go ahead down here. And both strong and equal. Put these socks up. All right, and now I'm gonna go ahead and apply some resistance and see how strong these are. Good. Now this way. Good. All right, so now I'm gonna do some range of motion exercises with your leg. Okay. So I'm just gonna ask you to bring this leg as high as you can, okay? Good. Now the other one. Good. And now go ahead and bend this leg to your chest. Good. Now that leg to your chest. Good. Now I'm gonna go ahead and push down, apply some resistance. Try to lift up. Good.
So now I'm going to inspect your legs. All right, so there is no hair distribution, patient shaves, no varicose veins, skin is intact. We have a scar right here, and that is on the right side, right leg. And so nothing other than that. And now I'm going to perform some strength tests on you. Okay. Actually, first I'm going to palpate for an edema. No edema present. No edema present. The came back in less than like 2 seconds. I'm also on your fingers. I'm going to do capillary reflex. Okay. So you press in. All right, less than a second. Less than a second. Less than a second. Less than a second. And less than a second. Okay, so your blood flow into your hands is really good. Okay, so next I palpated for edema and I temperature, so patient is warm to touch. And now I'm gonna have you take off your socks for me. You're good. Okay, and now I'm gonna do capillary refill on your toes. All right, less than a second. Less than a second. Less than a second. Less than a second. And less than a second. All right, good job. And now I'm gonna have you wiggle your toes for me. Okay, and I'm gonna have you spread your feet out. That's good. Now let me put your toes. Everything looks good. Skin looks good. Okay, and sorry, ridiculous. Okay, so now I'm gonna have I'm gonna check the soles of your feet. Everything looks good. Everything looks good. And now I'm gonna have you like raise your feet against my hands. Okay, nice and strong. Okay, and now I'm gonna have you I'm gonna have you press your feet down on my hands. All right, nice and strong. And now I'm gonna have you lift your legs. So I'm gonna have you like push your legs against my hands. Okay, good job, nice and strong. And now I'm gonna have you, we're gonna do range of motion for your legs. First, I'm actually going to palpate your popliteal. All right, it's about a 1+, good. And that's normal. Okay, I'd say that's about like a 2+ on both of your feet. And that is the tibial pulse. And now I'm gonna do your dorsal pedis. That's about a 1+, which is completely normal. That's good. Okay, and now I'm going to perform range of motion again because I want to grade it. So what I'm gonna have you do is press your feet up against my hands. All right, that's 5 out of 5. Press your feet on top of my hands. 5 out of 5. And now press your legs upwards. Let me push down. 5 out of 5. Okay, and now I want you to get on the bed, and I'm going to perform some range of motion exercises. Okay, so first I want you to flex your foot upwards. All right, now flex them down, or extend them down. Oh, we'll flex them down, and then now extend them up. There you go. Okay, and so we're full range of motion there, and now I'm gonna have you
Pick your leg up, all the way up, all the way down, all the way up, all the way down. Okay, and then I'm going to have you push your leg out, come back in, push your leg out, come back in. Okay, so range of motion on the hips is 5 out of 5. Now I want you to come and sit right here for me. Okay, and I'm gonna have you kick your leg out like this. Use your knees. Good job. And your other one. All right, range of